Toxicology is a very broad field. Basically, it could be poisons, it could be poisonous plants, fungi, it could be even drugs that the patient is prescribed. But then when they take too many of them, then it's an overdose. It's important to note that most toxicological agents do not present initially with specific symptoms. And sometimes what happens is that the physicians or the healthcare providers exhaust other potential causes of these clinical symptoms, and they turn to us with the possibility of a toxic ingestion of a substance. So imagine if a young child presents to the ER, basically in an altered mental status, sometimes even in a coma, and then they're trying to figure out what happened. Some of the investigation might suggest that the patient drank a bottle with an unknown fluid in the household, or sometimes maybe they find an open bottle of grandma's pills. These are two different possibilities, and based on the clinical history, we might want to basically test for ethylene glycol, which is antifreeze. And oftentimes we can find a substance and quantify it and relate that to the clinical findings in the ER. 3 substances that we commonly test for are ethanol, salicylates, which are basically an aspirin, and acetaminophen, which is the scientific name for Tylenol. Acetaminophen is a part of the formulation of many drugs that are over the counter, and so we always test for it because when we don't know what the patient ingested, chances are that this drug that they ingested included acetaminophen in it. It's a very exciting time for us at Yale Medicine. We've recently expanded our repertoire of state-of-the-art mass spectrometry instrumentation, the defining technology of the decade in clinical chemistry. This will enable us to bring in new and sophisticated tests and allow patients and their providers to get those results faster and to continue to deliver optimal healthcare. I'm Roa Harb, and I'm a clinical pathologist at Yale Medicine.